Good afternoon, and welcome to our webinar on Healthy School Buildings, Evidence-Based Choices in Safe School Openings. My name is Sasha Podolsky, and I am the Advocacy Director for AASA, the School Superintendents Association, and I am pleased to be your moderator for today's important webinar. AASA is thrilled to be partnering with our friends at the BASIC Coalition, the National Association of Secondary School Principals, and the National Association of Elementary School Principals for this webinar, where we're going to discuss what it takes to make and keep physical school buildings safe and healthy for staff and students alike. Before we get started, let's take a minute to review some general housekeeping matters and logistics. The first is to make sure that everyone's connected to audio. The audio is available from your computer, and so just make sure the sound is on. The second housekeeping note is about muting. To ensure each person has a quality experience, all attendees are going to be muted for the duration of the webinar. The third housekeeping item is about the Q&A segment, which will be a significant part of this webinar. So we have a lot of time for questions, and all questions will be fielded using the chat feature. I know it's counterintuitive, you go to the questions part, but you use the chat feature to ask questions. So please take a second now to look at the chat box on your screen, and if you don't see it, click on the chat tab and it should appear. And please send it to all panelists and attendees, or just all panelists if you prefer, in the pull-down menu. Just type your message and press send, and we will do our best to answer it. And we encourage you to post your questions as they arise, because we'll get to them at the end. And the fourth and final housekeeping note is that we are recording today's session to share with all registrants and other folks that you would like to share it to. So you'll get a recording of it, and then you can share it with whomever. And we are also live streaming this on Facebook as well. So now it's my pleasure to introduce our esteemed presenter, who will share his view on what school leaders need to understand as you try to maintain healthy buildings, healthy classrooms, healthy policies, healthy schedules, and healthy activities for students and school personnel during this pandemic. Dr. Joseph Allen is an assistant professor at the Harvard T.H. Chan School of Public Health and co-author of Healthy Buildings: How Indoor Spaces Drive Performance and Productivity. He began his career conducting forensic health investigations of sick buildings. And at Harvard, Dr. Allen directs the Healthy Buildings program, where he created the 9 foundations of a healthy building. He works with Fortune 500 companies on implementing healthy building strategies in their global portfolios and presents internationally on this topic as well. And most importantly to us, he has written some recommendations and guidance for school openings, and it's his expertise and insight into the education aspect of building safety that brings him to us today. And we're very fortunate, as he was telling me earlier, he is working 7 days a week, 4 a.m. to midnight most of those days, getting inquiries from school districts around the country, and he's going to share a lot of great wisdom and knowledge with you. And unfortunately, our other presenter, Emily Oster, had planned to join us today, but she had to unexpectedly cancel about 2 hours ago due to a personal issue. And I know she really wishes she could be here with us today. So sorry if you were looking forward to seeing her. We all were hoping she would be able to join us today. So with that, I'm going to turn things over to Joe, and he's going to kick us off with a presentation, and then we're going to get to the most important part, the Q&A. So take it away, Joe.
Great, thanks, Sasha. That's a kind introduction, and I want to thank you and AASA for inviting me to present. And I hope to be a resource to everybody here. That's my goal for this call. I want to share some of our reports on and ideas around risk reduction strategies for schools based on a report that we wrote back in June, and many schools are now adopting and implementing. And I share your disappointment, Sasha, too. Really looking forward to, I've been working with Emily and really looking forward to hearing her present. So another time we'll get together. I'll try to fill that gap, but no promises. So in addition to running the Healthy Buildings program at Harvard, my background is really in exposure and risk science. I'm a certified industrial hygienist. Industrial hygiene is the field that anticipates, recognizes, assesses, controls, and confirms that hazards are controlled in the workplace, be it radiological, chemical, or biological like we're facing now. And I've been doing this consulting for a long time. Outside of my role at Harvard, for 15 years, I've done forensic investigations of sick buildings, problems in schools, outbreaks in hospitals, cancer clusters in offices. And I mention that because while the pandemic is unfamiliar to all of us, there's a lot of aspects that are really quite familiar. We know how to assess a hazard, and we know how to put in controls to keep everyone safe. And in this context, it's kids and adults. So we know what to do, and we've learned a lot since this pandemic started on how to keep everybody safe. I'm a commissioner on the Lancet COVID-19 Commission, where I chair their task force on safe work, safe schools, and safe travel. So first, when we think about schools, I want to talk about the cost of school closures, which many are aware of. We've been writing about this since late spring about the costs that we're now seeing. And this includes things like virtual dropouts on the hundreds of thousands of kids who are just missing from the system. We've written about food insecurity, billions of missed meals due to closed schools, impacts on learning. We're seeing this in terms of literacy, loss in literacy gains, things that we predicted and we're actually seeing right now. We see more likelihood of failing grades, and this is happening everywhere in the country. Texas, Minnesota, DC, LA, Boston, New York, it's happening everywhere. We also know that kids who are not at school are at higher risk for abuse, exploitation, neglect, and violence. So very often the conversation around schools and risk has been focused on COVID and in the classroom, and hasn't really taken a wider lens on risk and the devastating consequences of kids out of school. This is nothing short of a national emergency. And we know how to keep kids and adults safe in school. Now, we do get a break. A room full of 25 adults is different than a room full of 24 kids and one adult, in that the risk profile for kids is different, very different. And this virus has not spared us in many ways, if any, except this one, that remarkably, kids are less likely to get this than adults, particularly the younger kids. What's robust is that they are less likely to die if they get this virus. In fact, if you look at CDC's data on excess mortality, comparing this year to previous years, for those under 25 years old, there's a 2% decrease, 2% lower excess mortality this year compared to previous years. Also looks like kids are less likely to transmit. This looks robust for kids under 10. I'd say the evidence is more mixed for older kids. Also, these are joint probabilities, less likely to get it, less likely to transmit, and less likely to suffer the severe consequences. Now, focus on kids there. I want to again reiterate, as I will many times, that our focus is not just on protecting kids, it's also on protecting the adults in the school. And so we actually know how to do this. We've seen this from not just our understanding of schools and risk, but also infection control in hospitals and offices and everywhere else. We know what works and we know what doesn't, because we've seen dramatic failures when controls are not put in place. So my team wrote a report in June, 60-page report on risk reduction strategies for reopening schools. At this point, many schools are open, so now it should be not just for reopening if you're closed, but how to stay open as case counts rise during this second wave we're experiencing. And we bucketed these into 5 different categories: healthy policies, healthy activities, healthy classrooms, healthy buildings, and healthy schedules. Now, really, I want to get to the question and answer portion of this. So I'm only going to go through one of these, and that is the healthy buildings, because I think many schools, I hope, are already doing some of these basics, like requiring masks in schools. But as we think about how this virus is transmitted, close contact, airborne transmission, so beyond 6 feet with in-room transmission, and very little from contaminated surfaces. And I'll talk more about that. In fact, I had an op-ed in the Washington Post that came out this morning with other colleagues highlighting how we don't have any evidence, no confirmed evidence of fomite transmission through contaminated surfaces. And we are over cleaning all of our buildings and spending resources in places we should not be spending them. We should be spending them on these healthy building strategies that are designed to limit the spread of airborne transmission. Specifically, you want to increase the amount of outdoor air coming into your school building. This could be as simple as opening up a window, or if you have a mechanical system, bringing more outdoor air. Any recirculated air ideally runs through a higher grade filter called a MERV 13 filter, MERV. Third, if you can't do those, or you want to supplement that, you should do this, or can do this, with the use of portable air cleaners with HEPA filters. Now, in terms of how to assess ventilation, one of the guides my team put together was a how-to. We spent the summer and weekends in the summer at schools around Massachusetts measuring ventilation rates, and then we turned it into a guide for schools everywhere so they can use this. It's a 5-step guide. And I'll pause for a second and say, and we can put it in the chat, that all of these resources are available on my Harvard Healthy Buildings Program website at forhealth.org. And we set up a special page for schools, schools.forhealth.org. If you just Google Harvard Healthy Buildings Program, you'll see forhealth.org and you can navigate to schools. All these resources are there. So if you think about one, how do you measure ventilation rates? How much outdoor air is coming in? You can use something called an airflow capture hood or a bolometer that simply measures the flow of air. And in this case, there's 444 cubic feet per minute of outdoor air coming in. And then we can quantify how many air changes that is. And I'll explain what that is in a second. We can also quantify ventilation rates using tracer gas. And here we use carbon dioxide. So the picture on the left is dry ice that we sublimated, that we increased the CO2 concentrations indoors. And then on the right, to determine how much fresh outdoor air was coming in, we opened up the windows just a couple inches. You'll notice one window is even closed. We just did as found conditions. That window was broken. And then doing this, we can see how quickly the CO2 leaves the room. And that is a tried and true measure or technique for estimating ventilation rates. And I'll show you what this looks like. So here's a graph looking at CO2 concentrations. Across the horizontal axis is time, and the vertical axis is CO2 concentration in parts per million. So this is after we loaded up the room with CO2. In this case, it was empty, unoccupied rooms. And then we watched how quickly the CO2 decays under different scenarios. So at first we said, well, let's use the unit ventilator, mechanical ventilation only. And you see we get about 1.6 air changes per hour. And then when we open up the window, we get a total of 4 air changes per hour. And then we open up the window and added a door opening, so it was a cross breeze, or less resistance to that airflow. We got over 5 air changes per hour. And for reference, an air change per hour is how much fresh air from outdoors comes in the space. A typical home gets half an air change per hour. A typical school, if it meets the code, should be getting 3 air changes per hour, roughly. We find most schools, when measurements are made across the country, rarely are hitting even that minimum. Now, importantly, we need targets. So what are we trying to achieve in terms of air changes per hour? So on the left is that triangle, the 3 approaches we recommend in that order: increase the ventilation rate, increase the filter efficiency on recirculated air to MERV 13, and number 3, supplement with portable air cleaners with a HEPA filter. You're trying to achieve a total clean air change rate between 4 and 6 air changes per hour. So that ACH is air changes per hour. And again, if you're meeting code, it's 3 air changes per hour. And we want 4 to 6 air changes per hour. Now, you can get that through any combination of those 3 factors. So if you look at that little formula on the bottom, it's actually quite simple. And we lay this out in the report. It's how much air is moving in or being cleaned. So that's the clean air delivery, either from outside or through a portable air cleaner. In this sense, I'm talking about clean air being virus-free, not necessarily clean of outdoor pollutants. But in the context of COVID-19, clean is virus-free. So how much clean air from outdoors, how much is going through recirculated filters, and how much is goes through a filter with a portable filter, with a HEPA filter, a portable unit with HEPA. It's a really straightforward and easy calculation. And I'll tell you this, we even built a tool with Shelley Miller at CU Boulder that's available on our website that walks through this calculation for you. So you can just put in the dimensions of your room, the length, the width, ceiling height, and it tells you how many air changes per hour of clean air you're getting, and also what you should look for if you're going to use a portable air cleaner. So we tried to simplify the calculation for you. And then if you're interested in the more technical, we also have a white paper on our website that explains the science behind the clean air delivery rate and use of portable air cleaners. Okay, I want to talk about a new piece we wrote just 2 or 3 weeks ago in the Washington Post, talking about distance in the context of risk, controls, and consequences. Specifically, we think the 3-foot distancing should be the norm in schools for kid-to-kid interactions, maintaining 6-foot interactions between adults and adult to kid. And here's why. So the 6 foot has forced schools to limit this in-person schooling, largely due to space constraints, right? And it's become this key factor in limiting the number of kids that are getting back in schools. And we lay out this 6-fold argument as to why. One, I've already mentioned that the consequences and costs of school closures are severe, and they are escalating rapidly. We are starting to see these reports every week now. We will see them for the coming months, and we will see them for the coming years. It is really hard to fathom that some kids will be out of school for an entire year or more. Hard to fathom the consequences. Number two, the strict 6 foot distancing that's keeping kids out of school has forced many schools into a hybrid model. Well, the hybrid model, I agree with my colleague, Bill Hanaj, an infectious disease epidemiologist at Harvard, who wrote about the hybrid model actually increasing risk for everyone. That's because there's an assumption, a faulty one, that when kids are not at school, they're somehow just at home and protected. But we know when kids are not in school, their social networks are actually wider. And so this actually increases the risk for everybody. Number three, the 6 foot distancing there is really no bright line cutoff. This is not grounded in any hard science. It was picked. I think it's a good idea to have a target, but there's no, medical or epidemiological evidence that 6 foot is a critical bright line cutoff. And you look at number four, there's been meta-analyses or analyses of many studies showing that when baseline risk is low, there's no additional benefit at 3 feet versus 6 feet. Number five, I think, is the most important, because very often we talk about these controls in the absence of context of other controls. So we say, well, some will say, well, 6 foot distancing, if we don't have that, it's a problem. And if we think about where the 6 foot distancing, or when the 6 foot distancing rule came into effect, it was roughly in February or March, before universal masking. When you have these other controls in place that we recommend in our report, universal masking, better ventilation and filtration, distancing becomes less important. So if we're going to talk about distancing, we have to talk about it in the context of other controls. If you look at what's happening, say, for example, in hospitals, high risk environment, they've largely controlled risk through stringent masking protocols, good hand washing, and hospitals take care of their ventilation and filtration. They cannot physically distance. So it's not one of the strategies that's used. And 6 is the point I've made before, that a room with kids is different than a room full of adults. So our strategies and risk reduction approaches should reflect that. And so our holistic approach here, this layered defense approach, if we layer enough of these control strategies on top of each other, we can control risks to both kids and adults in the classroom against the backdrop of what are staggering and devastating costs to having kids out of school. Last thing I'll do, and then I really want to get to your questions, is just point you to the resources. So at the bottom there, that's the website, schools.4health.org. We have this report that's available as a PDF. You can read it on the website too. We've translated it into Spanish. We have this ventilation guide. We have tips for selecting portable air cleaners. And all of the op-eds, 6 or 7 op-eds I've written with other colleagues at Harvard going back to July or June are all on this website, including the new op-ed on 3 foot distancing, one that just came out this morning in Washington Post on we're over cleaning our surfaces. So you can read about our guidance there, and I'm happy to answer questions on that too. But all these resources at schools.4health.org. And I'll stop there, and I'm happy to answer any questions that come my way.
Great, that was super interesting. So we are definitely getting some questions. One of the first ones I think is just a level setting one, which is when you talk about kids, are you grouping all children and for these recommendations together, ages 5 through 18, or just some of the stuff, specifically the 6 versus 3 foot rule in particular, change based on the age of the group that you're referring to?
So for me, in our guidance, it's for all kids, 18 and under, all the way through high school. I know there are others that only want to narrow this down to the youngest kids. Clearly, the impacts are more devastating on the younger kids. The learning is not the same. And we know a lot more about they're less likely to transmit. That's more firm. The reality is we can keep kids and adults, and kids in this context up to 18 or older even, we know how to keep people safe in any environment. It's a matter of having the appropriate control strategy in place. We can keep people safe in hospitals, high-risk environments, if we choose to. And so the same can be said for schools. Even at high levels of community spread, we know how to keep everyone safe in the building if these controls are in place.
Great. And what about density? Because we got some questions about, especially just generally, like states, it seems like they might be a little bit far behind where the science is or what your thinking is in terms of some of the recommendations that they're making that school districts have to follow. In particular, again, not having different rules for different ages of kids in the school, as well as just having rules like you can't have more than 50% density in a school building. How does that playing out right now in your mind?
Well, I think it's a mistake. And it's for the reason I mentioned earlier that this forces this hybrid model, which creates a false sense of security that it's somehow leading to lower community transmission or that kids are not interacting. I think it's forcing kids into other even higher risk activities where maybe controls are not in place. And we've seen that even across Europe, when schools have remained open, even in the context of higher spread, that schools are not the source of community transmission, right? And so, the density question is interesting, but if it's being used to keep kids out of school and creating a hybrid model, that's a problem. And also, if it's a higher density space, if you can keep even that 3-foot distancing between students and 3 to 6 between adults and 6 to 6 feet between adults, as long as you have these other controls in place, masking, better ventilation and filtration, first, let me be clear, there's no such thing as zero risk in anything we do. So can there be cases and spread in a school? Absolutely. This virus can be spread anywhere. We've seen it. Can we significantly reduce the risk through these strategies? Absolutely. Even at occupancies where every kid would not have to be sitting exactly 6 feet from each other.
Understood.
As long as the ventilation scales accordingly. Yeah.
Right. And someone asked about ionization systems and your thoughts on that quickly.
Yeah, I would. I don't recommend it. I was really clear in my recommendations. If you noticed, I didn't mention any new technologies, nothing expensive, nothing that's going to take months and months to implement. It's time for the basic strategies that we know work: better ventilation, better filters on recirculated air, and supplement with portable air cleaners.
Okay. And what about times like snacks time, lunchtime, when masks aren't being worn? Do you have any best practices or advice for districts and how to do that?
Yeah, I think this is really important. This would be a time when I would maximize distancing if masks come down, including increasing distancing for the teacher. I know in some school districts, even in cold weather, the teacher opens the window and spends more time near it. And this, if that means kids have to wear hats and coats or whatever it is, I think that's a good idea. We're in the middle of a pandemic, so the rules change. And I've been saying, we have to get comfortable being uncomfortable. If that means the room's a little colder, then so be it, because the cost of kids out of school is that severe. Another strategy I think is important. This starts to get harder to enforce, but is a good one. Masks down while actively eating and drinking. Some people are using it, adults too, in restaurants. Well, it's a mask break. I'll just keep the mask up for the full hour, even though I'm only eating for maybe 10 minutes, 5 minutes. It's not that long. So masks should be up when you're not actively eating. The other one that I've been laughed out of the room sometimes, and teachers, but I think it's a good strategy if you can try to enforce it. If you're eating in the classroom, you could try to have it be quiet time. It's different from how cafeterias normally are. I get that. But if you're having lunch in the classroom and the masks come down, if that's a quieter time, you have a lower emission rate. That's obviously harder to enforce, especially with the younger kids. But if you want a whole set of strategies, yeah, I think that's one we should try and do.
Those are great recommendations. We're getting so many questions. I apologize. I'm trying to group them together a little bit. So one question I had that came up was about studies showing that kids don't just transmit less, but are just tested less. And do you feel fairly confident in the fact that there's both evidence that obviously they're getting tested less, but what about studies showing that it relates to why their infection rate is so low?
Yeah, I think it's a good hypothesis, but it's been debunked. And so I'm on this, I chair the task force for the Lancet Commission, as I mentioned, on safe work and safe schools. And we have experts who study this, including myself. And one was just posting a review today that shows if you look at all the studies, including the ones that account for issues around testing, the different type of tests, seroprevalence studies, which are not biased by testing in any way, they're all saying the same thing. So that fact is not an artifact of some kind of issue around who gets tested, who doesn't, asymptomatic or symptomatic. It's actually robust, that the younger kids in particular look like they transmit less.
Great. And then what about issues with the humidification between 40 to 60% to control the virus?
Yeah, so I wrote an op-ed about this with some colleagues a couple of weeks ago. It's a good strategy, but I'll tell you, it's really difficult in schools, and there's a reason I didn't mention it in my core strategy set, because it's hard to do in schools. It is hard to humidify and get to 40 to 60% relative humidity. How does it work? Well, your lung defenses work better at 40 to 60% relative humidity. More mucus, better ciliated action that lets you bring up anything you breathe in and swallow harmlessly. Also, the virus decays faster at 40 to 60% relative humidity. That said, the mechanism of action for removal is quicker through ventilation and filtration. So if you had to say, well, I'm going to keep my school closed because my humidity is too low, let's say in the Northeast when it gets into winter and the relative humidity is low, I would say if you have good ventilation filtration, humidity is the next factor. I would say it's a nice to have, not a must have in this context.
Yeah, and that speaks to the fact that some folks are saying, well, what about offices and classrooms that don't have windows? What should we do in that situation?
So very similar, first, unless you're in a closet, there should be some kind of ventilation, right? So you can look at your diffuser and see how much outdoor air is coming in. If you truly are in a place that has no air coming in, there needs to be some airflow in there. Now, let's say you have a central room, no windows, maybe the airflow is not as good as it should be because maybe it's an older system in a building. That's the perfect place to have a portable air cleaner with a HEPA filter. If you put one in that room, and because there's not a lot of air exchange rate, the portable unit with the HEPA is going to be even more effective. And those, if they size them right, you can get 4, 5, 6 or more air changes per hour through that HEPA filter. So it's a nice way. I mean, we always want ventilation, but in the context of COVID-19 and disease transmission, the filtration is a nice way to fill a gap if you can't do ventilation.
And we didn't talk too much about busing, but I'm getting a bunch of questions now about that. So again, the density regulations in some states, it's making it very challenging to not do hybrid when you have that in place. So what do we know about the best practices for busing?
Yeah, I think there's been a misunderstanding about exposure and risk that translates to buses and even cars. And really, exposure is a function of 3 things: intensity of exposure, frequency, and duration. And if you look at how to control the intensity on the bus, the concentration, colleagues of mine did measurements of air exchange rates on a bus. Windows down just an inch or 2, you will get 30 to 40 air changes per hour when that bus is moving. Now remember, in a typical home in the US, half an air change. Minimum for schools is 3. We want 4 to 6. On a bus, you're getting 40. A hospital airborne infection isolation room gets 12 air changes. Point being, if you have kids on a bus with masks, keep a little extra distance from the driver. I wouldn't de-densify fully. Windows open just a little bit is a good way to reduce that risk. And I do want to say one thing off the bus, because my personal philosophy, I'm conservative by nature in terms of my risk tolerance. I follow the precautionary principle. I take my role as a public health professor very seriously. I have 3 kids of my own. And my gut check on all of this is always, would my answer be different if my kid was on that bus or in that school, or my wife was a teacher there? And so I'm not coming at this with any kind of cavalier attitude. It's really coming at it from a grounded in the science on exposure, risk, evidence-based strategies of controlling this in schools.
Appreciated. So we have some specific questions about UV and HVAC and in classrooms. Some schools are recommending that practice. Any thoughts there?
Yeah, I'd put it on that list where, I went 1, 2, 3, ventilation, recirculated filtration, supplemental 4, maybe advanced air cleaning technologies. UV can work. It's more expensive, higher maintenance costs. You have to be careful because you have a radiation hazard. It can be done. It can be put in the ducts. And really the only way I'd go to UV in this scenario is if I had recirculated air pushing through a filter and my system couldn't do it, because it's harder to push air through a better filter. So you get we call it higher pressure drop. And so if you need a way to clean that air, but you can't have the pressure drop, well, UV is just a light, so there's no pressure drop, and you can still disinfect or clean that air. It's just more expensive. It's definitely harder to implement, and you have to be a lot more careful in terms of the maintenance when you use that. So UV can certainly work, upper, in duct or even upper room, but I don't go there first in terms of schools. There are simpler strategies that are effective.
Great. Here's an interesting question I have too as well. Some schools are, of course, you have used in the past pin pads, finger scanners, that sort of thing, for a variety of things, whether it's, lunchrooms, et cetera. All students touch them because you said that, that we're over cleaning our schools and surfaces. Does that mean that we can return to using those kinds of things now?
Yeah, so fomite transmission. Fomite's just the word we use for any inanimate object that can act as a source of transference, right? So it's touchpads, a pencil could be a fomite, a doorknob, a railing. And if you look at all the data on fomite transmission, we actually don't have any confirmed cases through fomite transmission. Now, can it happen? Absolutely, it can happen. Is it driving this pandemic? No way. You could think about, like, for example, the choir outbreak. It's hard to see how you'd get like a 90% attack rate. 90% of the people got sick from one person through touching a surface, right? As soon as the second person touched a contaminated surface, you're going to remove a lot of the virus. But it's easy to see how through shared air, you could get an attack rate that high. So if fomite transmission is happening, it's not happening that much and it's not driving this pandemic. I'll also say this, it's easy to control through hand washing or use of hand sanitizer. So absolutely, we have to continue hand washing, hand sanitizer. That's a better way to break the chain of transmission. Because think about the logic of the surface cleaning we do, right? We clean all the surfaces, but it's impossible to clean it after every person has touched it. It's not practical, it's not possible. So already we're kind of, accepting that that's happening. And the better way to do it is to, in our report, we talk about building a culture of health, safety, and shared responsibility. Of course, stay home when you're sick. Hand wash when you come into the school. Every time you enter a classroom, every time you exit a classroom. So if you're building this into the culture, it's the better way and more effective way of breaking the transmission chain from any surfaces.
So as the mom of a kindergartner, I'm interested in what your thoughts are then on, shared books and project-based learning and those kinds of activities. I think that folks are dying to do with kids, just allow them to share the materials a little bit more fluidly and freely in classrooms, particularly the younger students. Is that something that, really we should consider going back to?
I absolutely think we should be thinking about this and allowing more of it to happen because one, it's not practical to, clean a pencil every time it's passed or clean a book. Doesn't mean we have to be, throw caution to the wind here. But I think if we have periodically hand washing and hand sanitizer in a classroom, that's going to be much more effective than any other approach trying to sanitize between usage. And if that's limiting kids' ability to actually learn and do things, then yeah, they should be encouraged because we just don't see a lot of evidence or any really that fomite transmission is really happening.
That's really great. That's really good news. Someone asked, does the recess fields and carpool areas that are outdoor mean that there's relatively no transmission happening there when kids are getting in and out of, out of the school building and in the cars, et cetera?
Yeah, I mean, is that essentially a question about the time outdoors?
Yeah, I think that's what they're getting at. I think they're worried just generally about, crowding, and say pickup lines and things like that, where kids are getting in and out of cars and
Yeah.
it's hard to do distancing.
Right. Yeah. I mean, this is one of the reasons too, why we see, if schools are not leading to all this transmission, and we know that distancing has been hard. Look at what happens before schools, after schools, outside of schools, kids are not distancing. We still don't see them being as schools being the source of major spread. You still want to encourage distancing. I think that's good. More is better. We just don't think the 3-foot distancing should be keeping kids out of school. But we want to encourage this. And outdoors, yeah, we get the benefit where the ventilation question is taken out from us because you essentially have unlimited dilution. Now you still have to worry about close contact transmission. So when you're outside, still absolutely masks should be on. I mean, I want to be really clear. The single most effective strategy for reducing risk in schools or anywhere is universal masking. And this simply this, right? Even if you have masks that are imperfect in terms of efficiency, take a 70% efficient mask, but particles have to go through 2 masks. So if I cough out 100 particles, 30 escape into space. Then they hit your mask where 21 get captured, another 70%, 9 get through. Universal masking has just reduced risk by over 90%. Now, the ventilation and filtration is what's going to take care of the space between masks. And outdoors, we have a lot of that. So you can quickly see how this masking can reduce the spread if we use good masks, take care of ventilation filtration. Outdoors, still wear masks. It can really drive down risk. And outdoors is clearly lower risk than indoors everywhere.
Right. That's a great example. That was really helpful. Thank you. Can you point to some specific schools which are at full occupancy and staying open using your layered advice?
Sure. I mean, I don't want to name schools I've helped or worked with, but there are many schools who, got our report in June, made a checklist, got it all done. So this is happening, and we see examples also of schools being reopened throughout Europe and different parts of the country with different layers of controls in place. So we absolutely think it should not just be schools, everybody back, jam-packed in, no changes. I mean, schools have to take this seriously in terms of these controls across all of the dimensions that we mentioned. So it's about behavior change, it's responsibility. Importantly, the culture of health, safety, and shared responsibility is so key, because you can only control, you being people who run buildings, school buildings, what's happening in your school. But that's a couple hours a day. It's not after school, it's not evenings, it's not weekends. And so it's really about building the culture of health in the community too, that everyone has a shared responsibility. We want to keep kids in schools, we want to keep schools open, we want to keep everyone safe. It's about all our individual actions, not just what can the school building do for the 6 hours you're in there, but what is everybody else doing to limit the potential for introduction of cases into school in the first place.
Right. Now, putting on your advocacy hat for a second, I'm seeing a lot of questions about, our state guidance is way behind. They're not doing these things. How long is it going to take for us to get new evidence-based guidance to the state or local level? And, how can we push this along a little faster?
Well, there's no question that we've had a total failure of leadership in this country since January, and we have not taken it seriously. It's been called a hoax. We've had misinformation coming from the highest levels of the government. It's led to widespread confusion. And unfortunately, this has permeated and percolated down to different states. So I'm hopeful that we have a new incoming CDC director, Dr. Rochelle Walensky, who's absolutely fantastic. And the amount of consistent information coming out of the federal government will change. It will change instantly on day one out of our CDC. We have the world's premier disease-fighting agency that has been utterly sidelined through the worst public health crisis we've faced in our lifetimes. It's incomprehensible to me. And we're starting to see some of this shift already, in that there's been a loosening or demuzzling of scientists in the CDC. So we see better guidance out there. Unfortunately, I don't think anything's going to happen in the next couple of weeks. We haven't seen it happen for the first 10 months, but I'm hopeful that as the new administration comes in, we'll see more consistent guidance. Not hopeful, I know it will happen, more consistent guidance on, there's no reason my program at the School of Public Health at Harvard should have had to create a report on risk reduction strategies for schools. This should have been done by the federal government early on, right? As soon as schools were closed in March. Schools have not been the priority they needed to be. So it's been confusing for everybody. I feel for parents, I feel for teachers, administrators, superintendents. It's been hard to navigate this. And a lot of it's because of a lot of the disinformation out there. It's been a confusing landscape unnecessarily.
Yes, absolutely. And in addition to that, there's of course, politics at the local level that play into opening and closing decisions as well. So one person asked, do you have advice on helping teachers unions or teachers or, just reluctant school folks understand and feel comfortable with your recommendations? Like how can we move in this direction? Because we're not always just bound by what the evidence is telling us in reopening decisions, unfortunately.
Yeah, certainly. I've seen that, and everyone on this call knows better than I do. The local politics have been, in my experience, just quite shocking, to be blunt. I'm not sure how to navigate it. I think the science is clear. I feel like when we've presented to teachers, parents, administrators, and there's this kind of forum taking place, and we say this is what the science is, I think it has given many comfort. I don't mean false comfort, but it says, well, here, let's understand the science and hear it. I know that has not been enough to move the needle in many places. But we have to make these decisions as a society, and we're making one in many places, that we're okay with kids being out of school for what could be an entire year. And I don't think we've quite grasped just how bad that is and is going to be in the coming years. These reports are trickling in, and they're bad. And we will see this. We know what happens when kids are out of school, and there are missing stories. These are just the stories we're hearing. But if you have all these kids missing, there's a lot that's not coming out. And I'm not, teachers are doing an amazing job trying to keep this going. Same with parents who are working. But it's a broken scenario where we have hybrid models, kids at home. When we know schools are not driving transmission, and we also know what strategies, if they're put in place, can reduce risk for everyone in the building, including adults.
Very true. Very true. This is a question around community transmission. How does community transmission rates impact whether or not students should be going to school if the rates are really high?
So we haven't seen this as community spread has increased in many places in Europe, that schools are influencing this, really. So, it's my opinion, and I think early on, many of us were watching and weighing in on at what level of community spread should different controls be happening. It's my opinion that we should have schools open regardless of the level of community spread. Now, that doesn't, like I said before, that doesn't mean we just open the doors and jam everyone in there and say it's like schools were last year. Right? You have to put in these. I would never advocate for any school opening in areas with high community spread without these controls in place. Right. Absolutely, masks need to be worn. Absolutely, you have to take care of these or do these healthy building strategies. But I just don't think we should have, for example, K through 5 kids out of school right now. I think the costs are just too severe.
Very true. This is a question I received. It's a little slightly off topic, but if you have good air ventilation and filtration in your home, should family members wear masks at home if some members work outside of the home or go to school daily?
So I don't think that's practical or really possible for most people, right? I would say some of these basic strategies, my window's open a little bit, right? We don't have people over who aren't in our immediate family. If we do, we meet outside. I think that's what we should be doing. But right, many people, if they're out working, they have to be out at work. I just think we take these basic controls. You have the portable air cleaner strategy. If you want to have a portable humidifier to increase humidity for respiratory health, I think that's a good idea. Open up some windows as best you can, recognizing in some parts of the country, it's about to get real cold. So you take these basic precautions, and then if someone is sick in your family or has COVID-19, then there are additional strategies you want to take, and we've written about these, and they're on our website too.
Mm-hmm. Well, speaking of cold, do you have any comments about ventilation in really Arctic or cold weather environments, and when the stress is there for districts?
Yeah, so this is what I mean about the ventilation and filtration working together. The clean air delivery rate or air change per hour are additive through any combination. So as you lose the ability to ventilate because it's maybe colder air and you can't condition as much, well, then the filtration becomes that much more important. Mm-hmm. So even if you're recirculating air, right, and you want fresh outdoor air for other reasons, but in terms of this virus, if you're recirculating air in a room, as long as it's going through a good filter, this MERV 13 or higher, you're delivering clean air. So, as ventilation becomes harder, filtration becomes more important.
Right. And someone said, can we just put a fan next to a teacher in the back if we have good, filtration systems just to keep the air flowing? And
so I'd be careful with just a simple box fan in the window to help bring in air. Let's say in parts of the country where it's temperate right now, great idea. As long as it's not blowing, past, let's say me to somebody next to me. So you don't want to be moving air right across the breathing zone onto somebody else. But a strategy, portable air cleaner, I keep going back to this. We've written extensively about it, putting it near the teacher, the middle of the room. This can really help.
Yeah. And what about special education students? We know that they've been the first in some cases to come back in districts. And some of those students, especially those who are medically fragile or who just have a mask exemption for other reasons, what kind of advice do you have about keeping them and school staff safe?
Yeah, really great question. And we were talking about this with the school district last night. And so the 3-foot guidance, I would not apply. I would say, look, if someone's not in a mask, you have to keep extra distance. This is where the de-densification becomes even more important. So how can you have fewer students and teachers per volume of space or per square footage of space? This is where the extra controls. So think about that idea, we have the dual mask and the ventilation filtration controlling space between the masks. Well, you lose the mask on one side, you want to have even higher ventilation and filtration targets. So in that kind of space, extra distancing, even more air or better filtration, and fewer people in that space. Yep.
And this is a question I think we received a couple times. I'm sorry I missed it. Wondering whether 25 high school seniors are more similar to 25 adults than they are to kids. So what would be the recommendation for adult groups of 25 in a room for an hour?
Well, these are the basics of what we've been talking about. At first, I don't think we should be having groups of 25 adults unless it's something that's critical, like, you're out of the grocery store, the pharmacy might have that number of people, but it's proportional to the amount of space. Here, adults should stay more than 6 feet or more apart. Everyone should be wearing a mask. The same strategies apply. The difference is with adults too, is that the risk profiles change. While the risk of death from this virus to young kids is extraordinarily low, it's extraordinarily high as you get older. In fact, if you hit in the 70s or 80s, it's remarkable how high risk this is. So we have to be cautious there and take extra precautions, recognizing the mix of people is different. Also, we have higher exhalation rates or emission rates for adults. It depends on the activity, right? I think a high risk place would be a gym, like a workout gym. You're in there and, small volume place and many adults in there breathing harder. And if someone's not wearing a mask, I think these are some of the highest risk locations we have, like a restaurant when masks are down.
Okay, and these are two tough questions about what should a district that doesn't have more of 13 filters do, or a school that it just currently doesn't have an operational HVAC system? How can they improve ventilation and filtration?
So if you don't have an operational HVAC, we've underinvested in our school buildings for decades and we're paying the price right now. I think many school districts are seeing this. It's not their fault. We've underinvested in schools buildings as a country for decades, really. So if you have a non-functional mechanical system, I'd say get that fixed. It's not acceptable to have a non-functioning mechanical system. If it's a poorly one, I think you could do a process called commissioning. I think it's a great idea for every school district. If you commission your system, commissioning is the process by which it'd be like a car getting a tune-up. You're making sure your system's working the right way. One, it'll save you money, better indoor air quality, and you'll find out what your system can and can't do. So commissioning is a great step. I think every school, every building should be doing this regularly, to be honest. So you have to think about the mechanical system is doing something, and it's just what can it handle? Can it handle better filters or not? And the reason we keep going back to the portable air cleaner, it's a total stopgap solution. I'm not in favor of using portable air cleaners, for the next 10 years in schools. But if you're saying, can we get through December through June, when these vaccines really start having their effect and benefit to society, can we get through these next 6 months of schools, even with a bad air handling system? Yeah, we can do that through these portable devices. There's a cost to it, but it's nothing. It's absolute pennies compared to the costs of kids being out of school.
Understood. Yeah. What impact do plexiglass shields around desks have? I know lots of districts invested in those early on. Are they actually helping to limit air recirculation in some instances?
Yeah, so we don't recommend plexiglass. Plexiglass is going to stop ballistic droplets. So, if someone coughs or sneezes, but masks also capture a lot of these ballistic droplets, right? Problem with plexiglass is that sometimes you change the airflow in the space. So if a plexiglass barrier is blocking air from a duct from coming in and diluting, you can have pockets of higher concentrations. So one way to think about it is that the room is not as well mixed, right? The air isn't flowing. You don't have air coming in from outdoors or being filtered. It can get stuck in these pockets. I think the use of plexiglass is good in fixed locations where there's a lot of people coming through. For example, at grocery checkouts, I think that's a great idea. Maybe at a desk or a cashier at the cafeteria, I think that's an okay idea. But putting them everywhere in the school classroom, I'd be more concerned about how that's influencing and diluting or preventing the dilution in a micro environment space.
In terms of, here's a quick, easy one. Do you have a specific portable air filter product or unit that you recommend in terms of, I don't know if anyone's been emailing you about their products and you feel comfortable referring them to any of them, but.
Yeah, I don't. I'm device agnostic for obvious reasons. So I don't recommend a certain brand, but we have this in the report. All you need to look for is the brand's CADR, clean air delivery rate. And a good rule of thumb is you want about 350 CADR for every 500 to 750 square feet. So say it again, look for about 350 CADR to be on the package or in the specifications of the device for every 500, 750 square feet. If you go to our website, we have that Excel-based calculator or Google Sheets that will let you type in the size of your room. You put in the clean air delivery rate. It'll tell you how many air changes per hour that you would get from that room. So you could say, for example, you have the interior room, a certain size, 8-foot ceilings. If I bought a device that was 200 CADR, how many air changes would I get? And that way you can see if you're going to hit that 4 to 6 air change per hour target we recommend.
Understood. Okay. We're getting close to time, so I'm trying to winnow down the remaining questions. So this is your last chance to re-up one if I missed one. I apologize if I did. I'm trying to do my best to get to everybody. Where are we? Oh, well, earlier, here's I guess a clarifying question. Earlier in the session, you discussed your concerns with hybrid learning, of course, but then you just said before that, 25 kids in a classroom isn't what we would expect to have. So since most classrooms, in some places have kids, class sizes larger than 25, and how can we kind of, is there a number that would be appropriate to have in a class? I mean, or is it all again depend on the size of the classroom and that sort of thing?
Yeah, I'm not sure I said 25, maybe I was talking about the 25 adults, but I don't think we should be using the space constraints, the 6-foot distancing to limit the number of students in a classroom. So if you have more students and you're hitting these air change targets with mass, as long as you have that ability to stay 3 feet away, and if you have more students in a space, it can't be an overcrowded classroom. So in our report, we document or say we give the default occupant density. So if you're going to exceed the default occupant densities from the standard setting body that sets ventilation rates, roughly 25 students to 35 per 1,000 square feet. If you're going to exceed that, you have to enhance these controls. Okay. So to be very clear, I'm not talking about we should jam, get everybody in the classroom, fill the auditoriums again. We have to still be cautious. But we shouldn't just be limiting the number of kids coming to schools. I've seen many schools, map out 6-foot little boxes for every student, and that means half the class can be in there. And that doesn't make much sense to me at all. Right.
Okay, that's very helpful clarification. Here's a question about emergency drills. So lockdown drills, for example. Can we do these? Should we try to modify them? Should we be practicing as we would in a real emergency? Any thoughts on that?
Yeah, that's a hard question. I'm not really sure what the answer is there, right? Because we want to, I would say if everyone's masked up, you want to keep doing your drills, certainly keep doing the fire drills. And if everyone's masked up, the risks again should be low. I would just have the adults stay further away, especially if it's in a drill. And the students, trying to keep 3 feet apart. I know that's going to vary based on the drill you're trying to do and your procedures and protocols, but clearly we should continue to do our safety drills, particularly the fire drills.
Got it. And then in terms of updates to any documents you released, we had a couple specific questions on different pieces of it, like asking about page numbers and things like that, but which you probably don't know offhand. Since there is such an emphasis around focusing on the community spread, someone said, it seems like you are indicating a need to move away from that. And the question was, are you planning on updating your formal document to remove metrics like that and to call out specifically the 3-foot spacing recommendation?
Yeah, so our report on risk reduction strategies, the revision in November specifically included the changes around plexiglass and 3-foot distancing.
Okay,
the report they're probably referring to is one I wrote with other Harvard colleagues related to community spread metrics that we wrote in July. I will tell you that we've been working on this for the past 2 months. And we have a revision to that coming out. And while I can't tell you what's in that report, I will tell you my personal opinion is that, yes, we should be moving away from community spread metrics as a basis to close schools. I think schools should be open.
Right. Understood. That's very helpful. Thank you. Okay. Again, I think folks just want you to reiterate that 3 feet is okay for any age group of kids. So K through 18, right? 3 foot is okay.
Yeah, that's my opinion. I think clearly the younger groups, there's less transmission, but I also think there are these, very often we've been everyone's having these conversation about the cost of being out of school. And we focus on the young kids. There are costs to teens, young teens, and older teens being out of school too. And we can control those risks as well. I mean, a lot of this, if we think about the risk strategies that are in hospitals, this is a very high risk environment. Many people actively infectious and shedding virus. And we control adult to adult risk or exposure through these stringent controls. Everyone needs a good mask. Ideally, we're beyond the time when a bandana suffices as a mask. A 3-layer mask that's fit well. There's all guidance out there. We release this guidance right over the bridge of the nose, tight around the nose, should cover around the whole chin with a 3-layer mask. It's not something we want, where the gaps out the side where air can escape. So we need a focus on, and I would like to see school districts specify what constitutes a good mask. There's enough out there. World Health Organization has put this out. CDC has put this out. We have studies showing what constitutes a layering of masks and what materials are effective versus anything you can buy anywhere or make on your own. So it's time for better masks.
Absolutely. And I want to end with just a comment from one of the folks listening who said, we can't thank you enough, Dr. Allen, for all that you've done and continue to do. Our school wouldn't have opened in August for in-person learning 5 days a week without the work of you and your team. And I know that's a sentiment expressed by many other people. And thank you so much for answering all of these questions. We're definitely going to make sure that everyone who RSVP or registered for this webinar gets a copy of it that they can share again. It's on Facebook Live as well. Thank you so much for spending this time with me. We were sad not to have Emily Oster with us today, but you did an incredible job sharing your knowledge and expertise on so many different issues. So thank you again for doing this.
Yeah, thanks, Sasha, and thanks to everybody. I really appreciate having the opportunity to talk. I hope it was helpful and answered your questions satisfactorily. And, we're all in this together. I believe everyone's really has the best interests of kids in their mind, and everyone's doing their best. And hopefully this gives you some guidance for how we think is a path to keeping your schools open or getting them reopened if they're not open. Thanks.
Absolutely. Thanks everyone for joining us. Stay safe.